Ever wonder if your sleeping position reveals something about you? Well, it's not as far-fetched as it might sound. Our sleeping positions can indeed hint at aspects of our personality and health. Today we're going on a fascinating journey into the world of sleep, exploring the potential meanings behind the way we snooze. We'll be delving into 4 main sleeping positions. First, we have the back sleepers, also known as the starfish or soldier position. Then we have the side sleepers, who are divided into right and left side sleepers. The third position is the fetal position, where people curl up into a little ball. And lastly, we'll talk about the stomach sleepers, who are often known for their unique and somewhat uncomfortable sleeping style. So let's dive in and see what these positions can tell us about ourselves. Starting with back sleepers, often seen as comfortable and confident, this position is all about relaxation. Back sleepers are often the life of the party, exuding self-assuredness and an easygoing nature. They're not just laid back in their sleep, but also in their waking lives, showing a level of confidence that can be both enviable and contagious. Now let's dive a little deeper. People who sleep on their backs are also known to be logical thinkers, often preferring structure and organization in their day-to-day lives. They're goal-oriented and have a knack for keeping their eyes on the prize. But while back sleepers might be the picture of confidence and charm, this sleep position does come with a somewhat noisy caveat: snoring. Yes, the back sleep position is notorious for producing some of the loudest snores. This is because lying on your back can cause the tongue to fall back into the throat, obstructing the airway. This can lead to the vibration we all know as snoring. While snoring might not be a deal breaker for the confident back sleeper, it's worth noting that chronic snoring can be a sign of sleep apnea, a serious sleep disorder that requires medical attention. So, if your or your partner's snoring sounds more like a freight train than a gentle rumble, it might be time to seek advice from a healthcare professional. However, on the flip side, back sleeping is often recommended for those suffering from acid reflux. When you sleep on your back, your head is elevated, and gravity can help keep stomach acids where they belong, in the stomach, not the esophagus. So it's not all snores and freight trains for back sleepers. In conclusion, if you're a back sleeper, you're likely to be a confident, organized, and goal-oriented individual who enjoys a bit of structure in life. You might need to keep an eye or an ear out for snoring, but other than that, back sleeping can be a rather comfortable and beneficial sleep position. So if you're a back sleeper, you might be more confident and outgoing. But watch out for those snores. Next up, side sleepers, the most common of us all. There's something to be said about side sleepers. It's not just about turning to one side and drifting off. The side you choose to sleep on can tell a lot about you and may even have some health benefits. Let's start with right side sleepers. When you sleep on your right side, you're doing your digestive system a favor. It's believed that this position can aid in better digestion and even help to reduce heartburn. Right side sleepers are often characterized as relaxed and comfortable in their own skin. They're the kind of people who can easily go with the flow. Now let's flip over to the left side. If you're a left side sleeper, you might be doing your heart a favor. Some studies suggest that this position can be beneficial for your heart and even your lungs. And it's not just about physical health. Left side sleepers are said to be more creative and in touch with their emotions. They're the kind of people who aren't afraid to follow their heart, literally and figuratively. But don't get too caught up in these stereotypes. Remember that everyone is unique, and these are just general observations. Your sleeping position might say something about you, but it doesn't define you. And there's more. Whether you're a right or left side sleeper, you're likely to snore less compared to back sleepers. That's because this position keeps your airways open, allowing for easier breathing. So congratulations, side sleepers, you're probably having a peaceful, quiet night's sleep. So, are you a right side sleeper or a left side sleeper? Or do you switch sides throughout the night? It's interesting to think about, isn't it? And remember, there's no right or wrong side to sleep on. It's all about finding the position that gives you the best night's sleep. Whether you're a right or left side sleeper, it seems your gut and heart might be benefiting from your position. Now, onto those who curl up like a baby, the fetal position sleepers. The fetal position is one of the most popular sleeping positions and is named so due to its resemblance to a baby in the womb. It's a posture where you lie on your side with your legs curled up, almost as if you're seeking comfort and protection in your sleep. Now let's dive into the personality traits and benefits associated with this position. If you're a fetal position sleeper, you're likely to be described as sensitive and introverted. You may have a tough exterior during the day, but when it comes to sleep, you're just a softie at heart. You're the kind of person who cherishes deep, meaningful connections and values emotional safety. But don't worry, being sensitive isn't a bad thing. It often means you're empathetic, intuitive, and have a rich inner life. But what about the health benefits of the fetal position? Well, let's get into that. This position can actually help reduce stress. When you curl up, it's almost as if you're retreating into a safe shell, letting the worries and stress of the day melt away. This can lead to a deeper, more restful sleep, which in turn can help you wake up feeling refreshed and ready to face the day. Also, for those who are prone to snoring or have sleep apnea, the fetal position can be beneficial. It helps keep the airways open and promotes better breathing. However, it's important to note that curling up too tightly can restrict your diaphragm, making it harder to breathe. So if you're a fetal position sleeper, try to relax a little and not curl up too tightly, and there you have it. The fetal position sleepers amongst us might be more sensitive and introverted, but they're also tapping into a natural and effective stress-reducing technique every night. So if you find yourself in the fetal position, you might be more sensitive and introverted, but hey, at least you're reducing your stress levels. Lastly, the less common but still present stomach sleepers. Stomach sleeping, also known as the free fall position, is perhaps one of the least preferred ways to catch some Z's. But those who do favor this position have a unique set of characteristics. Stomach sleepers are often described as bold and sociable. They are likely to take the initiative and are not afraid of taking risks. They love freedom, dislike criticism, and are known for their stubbornness and perseverance. However, this sleep position can sometimes reflect a sense of nervousness or discomfort. It's as if the sleeper is trying to hide from the world, burying their face in the pillow. This can translate to a certain degree of pessimism or negativity in their waking life. But don't fret. Sleep positions are not set in stone, and neither are their associated traits. As with every sleep position, stomach sleeping has its share of potential health concerns. The most common of these is the risk of neck and back pain. When you sleep on your stomach, your neck is usually turned to one side, which can cause strain over time. Similarly, this position can lead to lower back pain as it flattens the natural curve of the spine. Moreover, stomach sleeping can lead to wrinkles and even breakouts due to the constant friction between your face and the pillow. It might be worth considering a switch to a different sleep position if you're prone to these issues. Sleep is a complex and personal experience, and the way we sleep can reveal subtle aspects of our personality. So, if you're a stomach sleeper, you might be a bit stubborn and pessimistic, and you might want to watch out for those aches and pains. So have you figured out which type of sleeper you are? Let's do a quick recap. Back sleepers are often confident and outgoing, but may snore a bit. Side sleepers, the most common type, can experience different benefits, depending on whether they lean to the right, aiding digestion and stress relief, or to the left, benefiting the heart and lungs. Fetal position sleepers tend to be sensitive and introverted, finding comfort in this secure position. Lastly, stomach sleepers, though few, might be stubborn and pessimistic, and could experience neck and back pains. So what's your verdict? We're curious to know. Drop your sleeping position in the comments below. And remember, this is just a fun exploration. Everyone is unique, and these are just general observations. But who knows, understanding your sleeping position might just give you a little more insight into your personality. Keep in mind, these are just general observations, and everyone is unique, but knowing your sleeping position might just give you a little more insight into yourself. Sleep tight.